Now, Tara on TMA.
Good morning. If Ebola came here to Charleston, are our hospitals ready? Yesterday, MUSC said, yes, we are. Here to talk about that is MUSC CEO, Dr. Pat Cawley. Hey, doctor.
Thank you, Tara, for having me this morning.
Yes, thank you for joining us. We certainly appreciate it. Well, let me jump right in. If an Ebola patient was to walk into MUSC this morning, are you ready?
We are definitely ready. We've been working with the staff for several weeks. That's the most important thing, is getting your staff ready. The second thing is equipment, having all the proper personal protective equipment. And the third part is having a place with the right kind of room, the right kind of anti-rooms to place patients in. And we do have a unit where we can handle up to 4 patients. So the combination of staff, equipment, and facilities is what is needed today.
Dr. Cawley, can I ask you something? And I'm hoping you can clarify this for me. They've done interviews with the doctors at these 4 centers that specialize in biocontainment treatment. And here's Dr. Richard Besser to ABC News. Listen, to do it safely, the most important part is to do it safely. The most important part, healthcare workers need to train and practice using protective equipment like they have been doing at Emory and Nebraska. And they say the most important part of the protocols is to keep the disease from spreading, and that is getting into and getting out of the uniforms safely. So here's my question. I talked to Dr. Danielle Schur yesterday after the press conference, and I asked her about that because you guys have some new gear that they're not used to wearing before. I said, have you practiced putting on the gear? That's the most important part. Here's what she said.
Very few of us have ever had to have the head-to-toe N95. So we just want to make sure they can get each individual part on in the right sequence. So most of us have worn pieces of this gear, but not necessarily the full donning of the gear. And the sequence is very important. So what do you put on first, and what do you put on last, and what do you take off first, and what do you take off last?
But Dr. Cawley, I asked her, okay, so you've practiced this, right? I mean, you've had a formal training session putting this on. This is the most important part.
Okay, but have they had any formal training yet?
I wouldn't say formal training.
She said no formal training on this. I asked her again, okay, so have you done it? And she said, no, basically, we're going to. We wear parts of the equipment regularly. We don't wear it all.
So we, again, through our existing disaster management infrastructure, we already do a lot of training. So what we're planning on is those 10 nursing volunteers and the repertoire physician volunteers that we're going to have them, put on and take off with the buddy system several times before they're ever asked to walk into a room.
But Dr. Cawley, she said they'd never done it before. If an Ebola patient walks in this morning, how will they? I mean, they haven't practiced. How can they be ready?
Well, so what she's pointing out is that we do large pieces of this today. If someone were to walk in this morning, I would say staff is fairly comfortable. But what we would do is, because what would have to happen immediately is you would have to identify one nurse and one doctor to take care of the patient, and that's going to be in 8 to 12-hour shifts over a 24-hour period. What we would do is, as soon as we know who that nurse is, we would take that nurse and that doctor through the updated training immediately. And know that the CDC guidelines have just changed in the last couple of days. And we would take them through it, and we would walk them through it until they feel comfortable. No one is going to take care of an Ebola patient until they feel comfortable actually being able to go in the room safely.
Yeah, but you're telling me, sir, with all due respect, I'm just concerned. I mean, you just told me you were willing to you could treat an Ebola patient this morning, but now you're telling me if they show up, then you'll do the practice. You'll do the practice sessions. And Catherine Templeton, our health director for the state, has said you guys have been practicing this for weeks. That's not what she just told me yesterday. Could you reconcile that? I mean, to me, it seems like if the Ebola patient's sitting in your ER, then is not the time to practice. I don't mean to be disrespectful. I'm just concerned.
Yeah, well, part of taking care of Ebola patients is as soon as you screen somebody and you suspect they have Ebola, to isolate them. So they get put in a room.
Okay.
And if it was in our emergency room, we have the room identified, right? But that's not the room where we will take care of the patient for the next several days. That patient has to be moved to another facility in the hospital. What we would do is any staff that would then be taking care of the patient, we would do immediate training right then and there, update them on any of the new procedures, anything they have to do differently right then and there. And we feel that real-time training is the best way to do it. And then once they felt safe, then we would move the patient to the place where we're going to take care of the patient for the next several days. And then what we would do is, as each shift comes in, as the next shift of doctors and nurses is identified, we would actually bring them in and train them in real time.
Why hasn't that been done yet, though? I mean, Catherine Templeton said, our health director for the state, it's been going on for weeks. But again, that's not what I heard yesterday. You're telling me you're going to do the training on the spot when the Ebola patient shows up. Why not do it now? Why not get the shifts of nurses and doctors ready now so you're prepared?
Well, we put personal protective equipment on every day.
But she said you've got new equipment they've never used before. She told me that, and they've never practiced it. And we're hearing from these doctors. I mean, I've got an interview right here at Emory where when they drill every month, and that's what they drill: on with the equipment, off with the equipment, how to move back and forth so as not to contaminate. And you guys have never done it once.
Well, no, I wouldn't say we've not done it once. I would say our staff is familiar with the process. As to the exact process we would bring them through at the time with the new equipment, we would bring them through that training as well. So it's not like they're walking into this completely unfamiliar. Mm-hmm. They put personal protective equipment on every day. This is a step up above that. So what I'm talking about is training them on that step up above the normal protective equipment that they put on every day. And we feel that we can do a lot of real-time training if something happened this morning. In the meantime, we've started training to do this longitudinally over the next several weeks.
Okay. And I have Dr. Patrick Cawley, and you are the CEO of MUSC. A couple more questions. They seem to be sending these Ebola patients now, if you just, watching the news, to one of the 4 biosafety level 4 facilities in the country. And the WHO, World Health Organization, has said that is the optimal place to treat them. Is that your plan ultimately, is to send them there? Because you have said, hey, we'll take in, you can send Ebola patients to us from around South Carolina. We'll take them, we'll treat them. Do you intend to treat them there throughout their full illness, or do you anticipate sending them actually to one of these 4 facilities?
Well, this would really depend on what the CDC and DHEC would like to do. So, we're ready to take the patient today, but then what will happen is we'll call in the CDC, we'll call in DHEC, and it'll at the end of the day, it's going to be their call where the patient goes. So if they feel the patient needs to go to one of those 4 centers, then we'll transfer the patient at that time. It'll probably come down to a capacity issue in those centers.
Doctor, I want to play this for you really quickly. This is off of ABC this morning about what other hospitals are doing to prepare for Ebola.
At Rush University Medical Center, staff is being trained how to handle Ebola patients on levels ranging from someone showing symptoms to an Ebola patient whose life is at risk. Dr. Omar Latif.
All right, so that's what they're doing at other hospitals. Again, I asked Dr. Danielle Schur about this yesterday. What kind of formal training have you had for staff? And she had said, again, well, we haven't had formal training sessions. It's already built into our diagnostic system to look for Ebola. I said, so you haven't sat down. You haven't had a formal training session with these folks. You haven't taught them how to spot the signs. And she said, no, it's already built into our system. But here on ABC, I'm hearing other hospitals are doing formal training sessions. They are teaching people how to spot the signs. Can you reconcile that for me? And I'm not a medical professional, so there may be something I'm missing.
Well, I'm not sure of the training in other hospitals. The most important thing to do today is to properly screen patients coming into any place in your healthcare system. Mm-hmm. An emergency room, a doctor's office, a clinic, anything. That's the most important thing. So screen and isolate. So what we've done across our system is make sure that all those entry sites know how to screen. And we've done that fairly extensively. And as you saw, we know Catherine Templeton, when she came in last week through kind of an abnormal, not a typical place through our system, she was immediately screened for symptoms. So that's the most important thing. Screen and isolate. Mm-hmm. And that's part of our normal emergency preparedness training that we do. So if you come into MUSC at any place, you're going to see signs that if you're having symptoms, report, and then you'll be screened. Very, very similar in some ways to what we do regularly when flu season comes. And if you come into an MUSC place to be cared for, you'll see signs immediately that report your symptoms, and the mask is put on you immediately. So I feel very, very confident that that will occur, and that occurred in a secret shopper visit by Catherine earlier in the week.
But have you had formal training sessions for your employees about Ebola? Has there been any kind of sit-down session they could attend, anything like that?
Well, what we've done is we've actually, we have 13,000 employees at MUSC.
Mm-hmm.
So most of that is done electronically through emails and electronic systems and messaging to remind them what the symptoms are. And the symptoms are fairly vague early on.
Yeah.
Fever and just kind of feeling
That's what's scary about it. So have you sent out an email? Did you email all your employees? I just want to know how they learned about it.
Yes. Emails and electronic communication is the primary method.
Okay, so you have sent out emails. How many have you sent out?
I couldn't give you exactly.
Yeah.
We've been sending emails out for weeks.
But everybody's gotten an email about Ebola, but no formal training session that they had to attend.
Everybody's gotten the training via the normal emergency preparedness, which we do, is to keep people aware, and our normal electronic messaging that we send.
Dr. Pat Cawley, got one more question for you. Everybody's talking about this morning. You've probably seen it in the Post and Courier, all the reactions from locals about MUSC, I guess you would say volunteering to take Ebola patients from around the state, not from out of state, but from around the state. A lot of people not happy with that, saying, why take the risk? Why bring them here? Why bring them to Charleston? Why invite this here? Some even saying, I wouldn't feel comfortable going to MUSC knowing, that they're doing this. Why volunteer for that? I mean, maybe it's a selfish question of me, but why volunteer for that? Why take the risk? Why take that on? And should people feel comfortable coming to MUSC if you were to have to start taking all these patients you volunteered to take?
Well, first I would say I think it's our duty as a healthcare organization, and particularly as a state healthcare organization, to take care of patients in South Carolina. That's our mission, is to take care of the patients, and predominantly the sickest patients. So I think it's part of our mission. But you're absolutely right. It must be done safely. It must be done so the public feels comfortable about it, and we feel confident that can be done. And we'll communicate very, very widely with the community if we have a patient here.
Talking to Dr. Patrick Cawley, the CEO of MUSC. Anything else that folks need to know about this that I haven't asked you, Doctor?
Once again, the main thing I would stress at this point is screening. Mm-hmm. And I think people need to get educated on the symptoms, which are fairly nonspecific in the beginning, fever and just not feeling well. But combine that with the travel history or exposure to people with the travel history is the most important thing. So if you can answer yes to both of those questions, you need to seek help immediately.
All right. Dr. Pat Cawley, I know you're a busy guy. Thank you so much for joining us this morning on 1250 WTMA.
Great. Thanks, Tara.
Thank you.